All right. Hey, everyone. Welcome back to Basically EMS. We're going to be doing a bit of a different thing today. We're going to be answering some questions that people sent in. So it should be pretty fun. Yeah. So wait, how are you today?
I'm just great. How are you today?
That's good. I'm good.
Yeah.
I'm good. Yeah. That's
Beautiful fall-ish day.
a little fallish.
Yeah, kind
That's
of
true.
cold.
Yeah, like last week it was like 100, and I feel like this morning I was like, "Ooh, where's my hoodie?"
That 52 degrees hoodie season, baby.
And then it's Idaho, so 3 weeks from now it's going to be like -7 in the morning.
Yeah, or I'm going to be sweating. There's no in between. We don't really know.
Yeah, that's true. But we digress. So let's get into some questions. So number of questions. We're just going to kind of work through them and answer them to the best of our abilities. Just, remember we're answering for our personal experiences and all of that. So maybe other people would say different things, but you can hear what we have to say about some of these things.
Throw it in the comments if you have a better answer.
Yeah. I mean, we're pretty big on being collaborative and being a resource for lots of people. So if you have something different, or there's going to be a couple of things we don't have much experience with that maybe you want to throw out there, not a bad idea.
Yep.
So first question we got, after getting your EMT, what certifications would you all recommend or not recommend getting? EMS Compact, WFA, Red Card, etc., just in general, or if someone's planning on going on to paramedic training. Also, what are your thoughts on amphibious medics and other large companies that employ all over the U.S.? When starting out after EMT, would you recommend joining an ambulance or doing contract work? Thank you guys so much. So I think kind of twofold question there. Maybe let's talk about certifications that we recommend or don't recommend after EMT school. Do you have any you want to just jump right into?
Yeah. I mean, so when it comes to extra certifications after EMT, I think it really depends on what you want to do with it.
Yeah.
If you're someone who's like, I want to be an EMT for a hotshot crew, or, a wildland thing, maybe getting your red card, getting fire certed for out there is something worth your time. Same with like a woofer, if you're going to be somebody who is, like a raft guide or whatever, it could be applicable. I would say it wouldn't be mandatory or super necessary. To that degree is the same thing. It depends on what you're looking for. Like if you're looking to just run on like your standard ambulance or your standard fire crew, your EMT and whatever required trainings they're going to have you do is what I would push you to.
Yeah, and always remember that certifications are not all built the same. So a couple examples here, like Red Card. If you don't watching this, you don't know Red Card. If you want to go be a wildland firefighter, there's some certifications you need to have, including your Red Card, which is I think Red Card's like the safety and all that, your 11s and 13s or something. It's been a long time since I got my Red Card. And even typically if you want to go do contract work and work the EMS medical side, on big wildfire scenes, you still have to have your certifications, your Red Card and all of that. So that's kind of a nationally standard thing and all that, where like wilderness first aid, there's no sanctioning body really for that. So important to remember that some of these, like if you get your Red Card's going to transfer wherever, where wilderness first aid, you can have yours from like a Knowles Wilderness First Aid, or it could be a different company, and those aren't really the same thing. There's no standard criteria set for what a wilderness first responder or wilderness first aid or wilderness EMT, what any of those, there's no set standard for that. So just something to keep in mind when we're talking about certifications, that like you were saying, have your goal end in mind and think about what you need to get there. Because maybe you want to be a raft guide and they're going to like you to have your woofer, but maybe they're not going to accept the one at the training center close to you, and you're going to need to get one that is a Knowles one or whatever it is. So definitely look into that as far as these certifications.
I would even add on to that too, of like, depending on your area, but like your Fire 1 and Fire 2 certifications, right? Like that's going to be, if you're doing something like a county-based fire job, a lot of them, not a lot of them, but I'll stand back on that. A lot of them are probably going to have you get a Fire 1 depending on where you're looking to work. So like for a couple of the local counties here or local city departments here, they require a Fire 1 for application. So, depends on what you need to meet the criteria to be employed also.
Yeah. Yeah, and typically on the fire side, the bigger departments won't require any pre-fire training, where a small department that doesn't have the capabilities of putting 20 people through a tower to train them to get their Firefighter 1 certification, you're going to have to do that independently. So at least West Coast, all that. That's usually community colleges that will offer that. And then even still, I did a fire academy. It was 2012, so it was a long time ago, through a community college. And I didn't walk out with my firefighter one. I walked out with my fire academy completion certificate that allowed me to go find a volunteer reserve position where I would get trained to the firefighter one level. So this is kind of a hard question especially for the fire side, because there's no just absolute answers for it.
Right.
So just, like you were saying, same thing with the firefighter one. What's your end goal and what are the requirements? On the EMS side of things, I would really say ACLS and PALS are going to be really good ones to get. So advanced cardiac life support and pediatric advanced life support. Those are AHA classes. You can find them tons of places. That's a standardized thing. Is it required to go and get an EMT job? No, but it looks really good for your EMT job, and it just expands your knowledge really well. So I think those are really helpful, especially if you want to go to the advanced level or the paramedic level. They're not required at the advanced level, but those classes are required generally at the paramedic level. So you're just kind of getting yourself a step ahead, doing some additional training to help you be ready there. And then just going into the field, for medical knowledge. I did, as I was prepping, because for me, I finished EMT school. I wanted to be a firefighter. And especially Southern California, you want to be a firefighter, the easiest way is to become a paramedic, right? So it just opens up a lot of job opportunities for you. So once I started working as an EMT, I was just like, those were my goals. So whatever I could do to move towards those, I was going to do. And so as I was trying to get into fire academy, I was also applying for paramedic school. I ended up getting into the fire academy first. And so I did all the fire stuff. And then when I got out, I was like, well, I really like medical. I want to do the paramedic school. And so that's when I started working towards those things. So before paramedic school, I took ACLS, I took PALS, I took an EKG course through the local community college, and I took anatomy physiology, which was a requirement for some of the paramedic schools. To me, that's what it was, is kind of how I did things. Is I know what my end goal is. Here's all these things I can do. I'm going to do every single thing I can to try to go get these jobs that I want as my end goal. And then everything that I was learning just made me a better provider regardless. So,
right. And there's different certifications too, like PHTLS and AMLS. Like those would be at the ALS, like medic scope. Those are really helpful. My 2 cents on ACLS. Before you just hop on and sign up for an ACLS class, you do need to have a little bit of understanding of EKGs. So if you're like, oh, I'm a BLS provider, I'm going to be a BLS provider, and I'm just going to take this ACLS class, you're probably going to struggle very hard. So just some background, if you're going to take these, which totally recommend getting under your belt, but just have a little familiarity. There's a lot of resources out there to get you prepped for classes like that. So just might be a little bit extra legwork.
Yeah, and it might be something just watching some YouTube videos, and they've been breaking it down much more simply as ACLS has progressed. I feel like you don't need to really be able to call all the different rhythms. It's more like, is it normal, fast, or slow, regular, irregular, and it's kind of more algorithmic as it goes on. So it's a little bit easier than it used to be. But yeah, look and see what was there. My community college that I did it in had a split class, so. The first half of the semester was an EKG course, and the second half was ACLS that you went through. It might have been ACLS and PALS that you went through, but you're going to find those opportunities out there. And so, definitely look into that kind of thing.
Yeah.
This is a question we get a lot that I think we can kind of tack onto this. Advanced school or straight to paramedic? What are your thoughts on that, Wade?
I would say don't go straight to paramedic. Not to say it's impossible. For when it comes to from an EMT basic to advancing your scope, I think it really depends on the person and the time you're willing to put into it. I think the smartest way to do it would be the way that Chris coached a lot of people in my EMT class to do it that I didn't listen to. But, get your EMT, go get a job, work for at least 3 to 6 months. See, is this something I even like? Because this is something that a lot of people build these illusions of grandeur about, and then they get there and they're like, well, this is not Chicago Fire. It's one of those things you just got to get familiar. Now, for me, I knew end of the day I wanted to be a paramedic. Like my whole goal was to become a fire medic initially. So it's like, nope, I'm going to skip that. I already know where I want to go. And I thought I knew what I was going to do, get myself into, and then turned out to be a little bit little more, I would say. Granted, I also applied for paramedic school sitting in my EMT basic classroom. So that was definitely not the right move. Not to say, once again, insurmountable, but if you're going to make that choice, understand life is going to get hard and it's a learning curve and a half. I had a little bit of background knowledge and I have a degree in biology behind me already. So that carried me through most of the didactic. But like when it came to lab work, I saw all of my classmates who are currently EMTs killing this. And I'm like, I don't know what this looks like, feels like, smells like. I've never been out there, And so as long as you can kind of adjust and know that this is going to be a learning curve, this is something I'm going to have to just commit to, it's not impossible. But I would say when it comes to EMT, I think advanced is a good middle ground. It's somewhere where you get a little more responsibility, get to do a little bit more of the fun stuff. But also, end of the day, you're not the adult in the room, right? Depending on your system. If you're ILS, probably will be the adult in the room, but for just kind of the sake of this argument, right? Now, kind of, I've got two sides to this also, because there's another part of me that's like, well, you're going to learn all the AEMT stuff in paramedic school anyway. It's part of the curriculum, to the point like I barely know the advanced scope because I never had to work in the advanced scope, right? And so there's a little bit more understanding that comes with it. My wife was an EMT to an advanced EMT and then paramedic. I'm never going to say she's better at a lot of things than me, but it was very clear early that she understood kind of the assignment and was good at a lot of the skills already. And so that was kind of a leg up for her. So it really just depends on what kind of time you need to get to where you want to be.
Yeah. Yeah. My advice with this is typically like, what is your end goal and what's your timeline for that? Because, to me, if your end goal is paramedic, you're dead set on it. You want to be a paramedic within 2 or 3 years. Don't spend the $1,500, $2,000, $3,000, whatever it is on advanced school. Go get a job and learn that way, because you're going to learn, like you said, those advanced skills. It will give you a bit of a leg up, but I think having some field experience just as a basic would be better than just going to advanced school, right? So to me, it comes down to kind of a financial decision. So, if you're going to have to pay out of pocket for the $20,000 of EMT or of paramedic school, and that's already going to be a struggle, and for sure you want to go that route, I would say you're probably okay to save it. If you have you're in a state that has lots of financial aid, or you have family who's helping out with school and the cost isn't as big of a deal, it definitely is a beneficial thing before you go to paramedic school. So, that's kind of my take on it. But definitely I highly recommend, like I told you and you didn't listen, get some EMT experience first. I think if you're going the paramedic route, I think that's the best thing that you can do. And I've said it to lots of people before that for me, I don't think paramedic school was any harder than EMT school, because I was an EMT for 3 years before I even went into into paramedic school. So paramedic school was expanding my scope. I had a good foundation already, where EMT school, I didn't know anything about anything, and it was learning from an absolute zero. So I think like you just going straight through it, you were kind of bolstered by having your biology degree. But I think for people that don't have that, going zero to hero, EMT straight into paramedic, you just don't have any background to fall in. So, especially if that's your end goal is paramedic, flight medic, whatever, and you're just listening to this in EMT school, like the experience you're going to gain out in the field trumps any certification course or anything that we could recommend realistically for you. That experience is huge. And when I say experience, I mean go find a busy 911 system. Go find somewhere where you're going to run 10 plus calls on a 12-hour shift. And a year of that is going to teach you so much, way more than sitting in a ACLS class or a PHTLS class or anything.
Yeah, I'd agree with that. And then with just for the record too, the reason I even did that jump was I was actually looking to go to med school. And after speaking to a doctor friend of ours, he basically told me, well, your grades kind of suck, because I was an athlete student and I did that wrong. But he's like, you got to move somewhere like Texas where they have a lot of med schools. You got to get a job where you have experience to leverage. And so I was like, well, paramedic sounds like the coolest medicine job. And then I fell in love with it while I was out there, so that in my mind, it was almost like get the cert for the next thing. And then once I actually got my cert, it was like, oh, this is actually pretty cool. So, just also understand that when you're taking these classes, part of it is just to change your dynamic for yourself to see what you want to do. And it will shift very quickly. I obviously never became a firefighter because I enjoyed being on the ambulance, you know?
Yeah. And kind of part of this question too is any certs we recommend not getting. And I wouldn't say that there's any certs that I have taken or have seen that I would recommend not getting. Just make sure that they're relevant to what your end goal is. And I think it's going to be time and money well spent, realistically.
And then whatever cert you get also, just remember, especially if you're someone who has working experience, you have to jump through the hoops of that certification. So if you have 10 years, 15 years as an EMR as an example, right? And you go into EMT school and you're like, oh, I'm basically an EMT. Your experience helps you, but it doesn't guide you to pass what you need to pass to get the certification. So understand, if you're already certified in something and you're taking these extra certs, it's likely going to require you to kind of, holster a little bit of your experience depending on the circumstances. So just keep that in mind.
Yeah. Let's jump into the second part of the question.
Yeah.
So essentially what they're asking is, when starting out after EMT, would you recommend joining an ambulance or doing contract work? So I feel pretty strongly about this one. The ambulance is where you need to be if you're going to be starting, just because you're going to have so much more support and you're going to see so much more, I think, on an ambulance than doing the contract work. I think contract work is probably better. And I mean, contract work is a very broad question, or really broad subject. So there's a lot that can go into it. But based off the question we were seeing, it was like movie set medics and that kind of stuff is the place they were referencing, right? So
amphibious.
Realistically, for you to get that good experience and the good training and all of that, nothing beats just running calls. And so to me, doing those kind of things, it's probably mostly low acuity stuff when you do see stuff, and it's probably not going to be very frequent. So, getting on an ambulance, running lots of calls, having that big wide range of pediatrics to geriatrics, trauma, medical, super sick, really low acuity toe pains, you get to see the whole spectrum of everything when you're new. I think that's going to be kind of where your best experience will be gained from, especially if you want to continue in the EMS realm. If you're thinking you're doing this to become a doctor, become a nurse or something, I still would say not necessarily contract work, but then maybe like an ER technician job would be a really good place to start. If you can get those, sometimes they don't hire people without field experience, like ambulance experience. But if your goal is in hospital, I think that would be a really good place to start. Otherwise, I would say start in an ambulance. And then contract work to me is after a couple of years, you have some experience. Then you start to pick that up as kind of a side gig, or maybe you're going to pick that up altogether as your job. But I just don't feel like you want your first time running like a critical call to be like when you're just by yourself with limited supplies and you're in the middle of nowhere at Burning Man with the nearest help 2 hours away, right? Like to me, I would want to be in a metropolitan area running calls to get that first experience.
And I think I agree with that, especially because contract, like you said, is really broad. Depending on the contract, you might be like, no, we're relying on you to give these points for here and here and here. And if you don't have any good baseline experience, it's going to hurt. The only person I know who was genuinely going to do contract work, he was going to do it overseas. The dude is so qualified in so many different ways that it's like, well, yeah, that checks out that you would be the one I would want you to show up for me there, right? But just keep that in mind, right? Depending on the contract, if you don't have working experience on an ambulance, on an engine, on some sort of busy system, and you're in charge, it's not experience for you to leverage at that point because you don't have it, right? And it's only going to help you, especially if you're the main face of that contract. It'll go a long way.
Yeah.
Cool.
Yeah, let's jump to the next one.
Okay. So, any tips for STAR interview format or EMS interviews in general? I failed mine with my province ambulance service in Canada. I've always done well in and even enjoyed interviews, but this one kind of shook the old confidence a bit. Going to reapply in a few months, but wanted to see what the Council of Elder Medics had to say. Love from Canada.
Elder? That's not very nice.
Yeah. Respectfully.
Wise, I guess, but I don't know about old.
Hurts my feelings.
Yeah.
Anyway. So interviews are kind of a tough thing, and there's a whole lot of courses out there when it even comes to interview prep because it's a big deal. Now, the STAR interview technique I wasn't familiar with. Chris
Yeah,
wasn't.
we've never heard of that before.
Never heard of it. So I did print some things out. So for those who are listening, right, the STAR method, interview technique that helps candidates provide clear and concise answers to behavioral questions, standing for situation, task, action, result. So I'm just going to read this and then we can chat. So for the situation, describes the context within which you performed a task or faced a challenge at work. This sets the stage for your story. The task, explain the specific responsibility or challenge that you had in the situation and what was your role. Action details the actions you took to address the task or challenge. This is where you highlight your skills and decision-making process. And then result, share the outcomes of your action. What happened as a result of your efforts. If possible, quantify your success with metrics or specific achievements. I mean, kind of just going through it, that looks like a pretty solid way to answer your questions. For whoever commented this, I think it might just be leveraging the right kind of answer is probably going to be a big one with that. But interviews are all over the place and everyone's got their own kind of comforts with it. Like I never really prepped really hard for a lot of interviews because I do well in that kind of setting.
You talk well.
Thanks. I talk good. But yeah, it really just depends, right? Like, there's all sorts of, even reading a little book that we have here about interview stuff. Like I learned a lot from that of like, oh, I definitely could have applied this, and this, or some variance of it. But the way I always looked at the interviews is just answer as honestly as I could. And, everyone wants to kind of fluff themselves up a little bit in interviews, and that's kind of the place to do it. But at the same time, remember, you got to fluff yourself up in honest ways, right? Because there might be follow through and they're going to want to know more. I'd say with the STAR method, if you're comfortable with it, I don't see anything wrong with it necessarily. I'm sure there's other methods out there that are probably more effective, but I don't think that's a bad starting spot.
No, I like it looking at it. It's very similar. We have Cody's one of our guys. He teaches an interview course, and this is kind of similar. His thing, he has his like 3-part method. Answer the question, tell a relevant story, and relate the story back to the job you're trying to get, essentially is very watered down. And he does have a course you can go take that's way more in depth, and we've seen great success with it. So, it could go way more in depth, but this kind of seems like a similar thing. So, yeah, I would say, if this is the method you want to use, I think it's really good. I think one thing that can hurt people that come in with a really specific method is it can make you sound very robotic of like, okay, what's my S in STAR? Okay, it's going to be situation. What was my situation? And like, you just sound like I did this thing and then this, and every answer starts to sound the same and you lose your personality. So, that's one thing that you need to think about when it comes to like really falling into a method like this that can be detrimental. But I think overall, I think this is pretty good. I know I've hired a lot of people now in the position that I'm in. And I mean, to me, like for interviews, just like the little stuff counts so far, right? Like, how do you look? That is huge. And you would be surprised at the people that come in here that should know better because they're EMS fire people that come in for a second teaching job in like shorts and flip-flops, right? Like those little things go really, really far as your appearance and, and all that stuff's important. You're going to be nervous, but just try to be engaging, I think is really big when you're going in for interviews. Try to be friendly. And remember, like you're talking about kind of fluffing yourself up. It's also okay to be vulnerable, and that's gonna resonate with people because we all have our failings, and it's not about you being perfect. It's about how teachable you are, how much you've learned, and how much you're willing to grow. And so I think when you're answering questions, especially EMS style interviews, they don't expect you to be like, I'm the best paramedic or EMT that there's ever been. Let me show you how. Like, no, I did this thing that I really should not have done I crashed an ambulance, whatever, because I was not doing the right things or, I was running lights with no sirens at night when I shouldn't have. And I ended up getting in an accident. And ever since then, I've made sure that I'm always running my sirens when I'm supposed to and following protocols. And, just if you're going to answer questions, it's okay to not be perfect. Just what did you learn from situations, I think is a lot of what they want to hear. So, and this would kind of apply to STAR or the kind of the 3-prong method, like our buddy Cody teaches. Lots of different things that you can use, I think, to help yourself there. But I think a lot of it too is just coming in practiced, like not too practiced, but like what our buddy Cody again recommends is go find, 100 different standard interview questions and get a fishbowl and throw them all in there. And every day just pull out 5 and answer those questions and think about how you're going to answer them. You don't need to you don't want to memorize script, but having a structure and start to think about stories from your life, from your job. It doesn't need to be EMS related when you're doing an EMS interview. You know, like, were you in Boy Scouts? Talk about a Boy Scouts experience. Did you play sports? Were you on a team? This is a team-oriented career. Talk about, your sports stuff. Like, use your life experience so you can show off who you are as a person. But yeah, take every day, take 5 questions, come up with some answers, practice it. And this is a huge one that's really uncomfortable for people. You need to record yourself. Take a video, record yourself as you're answering these questions, and then watch it back. It's gonna be terrible. You're gonna hate every second of it, but you're gonna start to notice, like, wow, that question took me 9 seconds to answer. That's not enough. Most of these panel style EMS fire interviews are like, 15 to 20 minutes with like 5 questions. You're going to be expected to use 2 to 3 minutes per question.
Right.
You need to interview yourself and watch that back, see how your answers are, see what you thought about it, and watch for body language, those kind of things. So the best thing you can do is to kind of record yourself, look back, analyze what you said. And it's a muscle you have to train. Start to train that interview muscle.
Yeah, 100%. A couple of points. So like one and to that in particular is, when you like write an email or something and you write it and it's like, yeah, that sounds good. And then you read it out loud and it's like, oh, I sound like I don't know the words, right? Like, practice out loud. Don't just practice them in your head, because if you just practice in your head over and over, it's perfect in your head every single time. And then you say the words and your tongue doesn't work right or whatever. And then it's like, well, that's not going to be your best foot. And also remember, with a lot of these interviews, especially for like systems where you're going to be co-housing for extended periods of time, a lot of it is kind of a vibe check, right? Like, what is your personality? Is it going to mesh? Is it going to, are you going to be abrasive? So don't be afraid to let your personality show if that's a strong suit of yours. If it's not, figure it out. But it's one of those things of like, they want to make sure you're someone that also can get along well with the rest of these crews. Yeah. And so that's just an important aspect. So let yourself shine as well, your own personality.
Yeah. And if possible too, you can always seek feedback. Be like, hey guys, I was really excited to work here. This is really where I really want to be. And are you able to give me some pointers for next time? Cause I'm going to come back and I really want a job here, and show me how I can get that job. That goes really far, especially, at least in the US, fire jobs are so competitive. And a lot of the time, if people hear that, they'll be like, oh, hey, this person wants it. Like, this is who we want to hire. Right. And maybe they need the practice, but like, at least they have the personality and the drive, and that's what they're looking for. So,
and then maybe if you got someone who can listen to you, like mock interview, even if it's your mom or your dad, and then ask them, like, be honest and critical. Like, we'd rather them be hypercritical while you're practicing so that you don't sound as stupid when you're talking to a group full of people. Not everyone's stupid. I know, I'm sorry. But you know what I mean? Like, get feedback early, because that's going to be things you can work on. And if you can find someone who works in the service that you want to be working in, fire or ambulance, and you like have a buddy who is a firefighter, a buddy who's an EMT on an ambulance, work with them. They'll tell you what'll work and what won't, because they obviously got to the position they're in by doing the same stuff you have to do. Yeah. So just keep that in mind.
And I do think, Sabrina, I think we have like a 10 basic steps for interviews video on this channel that goes over really basic stuff that for some reason people fail really often. Like, don't have anything in your pockets. Your cell phone should stay in your car, right? Like, wear a suit, wear a dress blouse, that kind of thing. So not a bad idea too, if you're doing interviews. We do have a little video on that, to go check that out. It's pretty basic stuff, but, and not saying that this person didn't do any of this stuff. We don't know what that interview was like, but some little stuff, especially if you're 19 trying to get your first EMT job, your first your first big kid job that you've never had to do a real interview for, like it can really help to guide you with some basic things like printing resumes and bringing them with you. Those kind of things can really set you apart. So, definitely go check that one out. It can hopefully give you some good information.
Yeah.
Also, what's up, Canada? Pretty sweet. I love to hear the reach. It's pretty cool.
The siblings up north, kind of estranged.
Yeah, well, yeah, it's a whole different topic.
Moving on.
All right, so next one. Do you have any advice or guidance for someone who is very much a hands-on learner, struggling to put the texts and lectures into their vision for studying? Love what you guys do. Keep it up.
Mm-hmm.
So what do you think?
This is one I get a lot. A lot of people who get into, at least a lot of people who are really shooting for the fire service, they're hands-on learners.
Mm-hmm.
That's they learn by doing. And unfortunately, especially on the EMT side, a lot of it's didactic.
Mm-hmm.
And you have to figure out what works for you. And now when it comes to what works for you, there's methods, and you're going to have to kind of do the research yourself. Everyone's a little different. And so depending on your learning styles and kind of your experiences, what will help you actually and take this information and hold on to it is just going to depend as well, And so for me, with a lot of these students, some of them, it's just like, I don't like reading the book. Well, it's like, can you? Yeah, I don't like it. It's like, okay, well, I don't know what to tell you. Like, nobody likes reading the textbook, but if it's necessary. But that said, things like audiobooks, if you can find, there's a whole slew of hands-on kind of little skills, for lack of a better description, like the shock bucket that you do, right? Like there's little activities you can do to help, okay, this makes sense. And this is why I see this is going on, right? So you're going to have to kind of think outside the box, which yes, can kind of suck from time to time because it feels like it's more work, but it also, in kind of even backtracking to the interview, will apply because now you know how to critical think and start being creative around it, because a lot of this field in general is MacGyvering things. Like, oh, I don't have this piece of equipment, but I can make this work, right? So if you can start to, even with your own education of I don't like reading the textbook, I don't like listening to the audiobook, start thinking around it. What are the ways that we can start getting involved? Another really good way is quizzing yourself, finding some sort of quizzing, whether it's with peers or quizzing yourself, or finding, like Quizlet or something that makes its own note cards, and then you can quiz yourself off those. But testing yourself, right? Like for me, especially I met my wife in paramedic school studying with her. I learned really well by being called dumb when I got things wrong, but because no one wants to feel dumb, right? But then when you get it right, you get to throw it back in their face, and that's way more fun.
Feels real good.
But that's just one of the examples. I don't know about.
Yeah, I mean, I think there's some things you can do, right? Like some of it is just rote memorization that you have to kind of have to deal with, especially like you said in the EMS world. So, but you can still try to get a little more hands-on with if you're learning the bones of the body instead of just trying to memorize it, see if you can find a printout that has blank spots to write the bones of the body to get a little more hands-on with it, right?
Or a coloring book.
Yeah, those are out there. There's all sorts of stuff like that can help you with, learning anatomy. And then for, medical trauma kind of stuff, I think that these students tend to do a lot better with situational kind of learning. So, one thing I always recommend for students is take your list of your major medical complaints and list out signs and symptoms for that, and then build some scenarios based off of that you can run yourself through, essentially. So kind of like medical trauma scenarios, start to run yourself through those and see if you can make those connections start to click for you. Because really everything that we're doing is going to eventually be hands-on kind of more or less in this, but at first you're just learning theories for stuff. So realize that, do you need to have the whole book memorized? Absolutely not. But try to go through that book. If you're not going to read it for page if you're not that person, that's fine. Read the highlight stuff, right? Read the important stuff and start to learn what concepts is that chapter teaching me? What concepts are these books starting to teach me, so that you can know exactly what they're getting at. And then you can start to figure out a way outside of that fits more for your learning style. Right. So, and thankfully I think we're pretty good about it with our school, that we are a little more forefront of trying to get stuff that's a little more accessible for people that aren't your traditional learners. But unfortunately, a lot of education is still just kind of the basic, read the book, do the PowerPoint, and do the test. And so you're going to have to kind of search that out a little bit for yourself. But I would really recommend, doing diagrams, that kind of stuff, so you can start to write stuff out, and then coming up with some situation scenarios. And especially if you can find study buddies, that is really huge, that you can start to put those on. So instead of just trying to think about those things, you can have a teddy bear in front of you, and you can be like, okay, I'm going to go down here, and you said they have pain in their hips. Okay, so maybe that's a pelvic fracture, and you can get that hands-on to hopefully make those connections in your brain.
Another thing you can also try doing, and this is This is one where you got to understand a little bit, but it'll help you with your understanding. If you think you have a topic down, try to teach it. If you can tell somebody, like if you can give me a 2 to 5 minute blurb about, I don't know, CHF, whatever topic, right? If you can tell me something about it in a depth that's higher than just that superficial top-down read the page, and you can explain it, you're grasping concepts. So sometimes it's not so much like nothing's sticking. More is sticking than you know. You just aren't putting the effort to explain it. And if you can't explain it, then you understand. And it's kind of a reverse engineering of the whole thing, but it does help things stick.
Yeah. A couple of resources I really like for more visual learners. YouTube for Khan Academy is really great. And we have a lot of that in our online course. Khan Academy is really cool because they'll be kind of like the verbal lecture, but usually they're kind of drawing as it goes along, that I think is really good. Another YouTube resource I really like is the Amoeba Sisters, which I don't know if you've ever seen them. They're in a lot of when I built the advanced course, I put a lot of them in there. Same thing. It's kind of cartoony, kind of silly, little visuals that I think are really helpful, especially for A&P type of stuff. So, learning about cellular metabolism and about, the physiology of the body, I think that's really helpful. And then it's Dr. Mike and Dr. something. There's some Australian guys that I found a lot of videos from them to be very helpful and more standard lecture, but they draw really good visuals as well. So, YouTube is amazing if you are more of a visual learner. There's a lot of stuff out there that can really help with that. So, we preach pretty well here that if just reading the textbook and sitting in a lecture is not your thing, that's fine. Just go find what works for you and really lean into that, right? If you're not going to read the textbook front to back, that's totally fine. That doesn't mean you can't not search the knowledge, and you're going to have to go search the knowledge, but it's out there. This modern world, it's out there. There's lots of stuff you can do.
I would just be careful if you're going to be using sources outside of your textbook.
True.
Is that if, for example, if you were just to Google normal vital signs, you can get 7 different responses for what normal is. So just make sure it kind of matches guidelines of what your book is. Or if you're going to be searching in EMS, right, include something like that, because they'll give you nursing or doctor information that's either above where you need to be or it's slightly skewed, and it's going to throw you off when you get to the national testing stuff. So just kind of be discerning about what words you're going to use when you're searching.
Yeah.
Cool. Let's move to the next one. The next one's really long, so I'm going to read a synopsis of it. Sorry. So an 18-year-old starting paramedic school asks how an online presence might impact their career. They're curious if it's better to keep content professional, educational, or if there's space for creative outlets like humor, voiceover projects without damaging their public image. This is a murky world that we live in.
Oh, yeah.
You got to be real careful. I know of a medic that got into a little bit of a trouble with his TikTok. It started as very educational, and it started leaning more towards EMS thirst trapping near the end, and wearing your uniform and having your badge showing in the back of a rig of some sort. That's never going to be a good look, right? Anything you do and put on the internet is there forever, and they will find it. They are going to look. So it really just depends. I think that there's a place for humor, I like to think we're pretty funny, but from time to time, we throw in humor and it helps things stick, but we've kept things at a professional line. And that's an important line to find. Basically, if you don't want your grandma to see it, if you'd be embarrassed if anyone in your family saw that video, you probably shouldn't post it, especially if you're going to be wearing uniform stuff.
Yeah, I would say, and just comedy in general, a good line is you punch up, not punch. You never punch down, and so I think that's one thing to really keep in mind. And I know in this question he referenced Firefighter Chronicles and that kind of thing. So I don't feel like there's ever any mean spiritedness to that, right? And so if you want to kind of do that kind of stuff that's more content creation than just necessarily educational, I think it's fine. I would say though, that dude, I bet has been in this career for 15 or 20 years, and he can speak from experience with that. I think if you're some brand new, fresh face EMT kid and you're trying to make this educational content, you're going to have a bad time, right? I've been doing this stuff for 15 or so years. Wade's been 8
pushing
years,
10
years or something like that, right? So we can speak from experience, and So I know if I were to go try to get a new job tomorrow, and they found this, they would be like, "Oh, well, they've proved themselves in the field before they started talking," and that's really huge here.
Mm-hmm.
Even if it won't stop you from having a job, if you're new trying to present yourself as an expert in this, your partners are you're gonna struggle with your partners and your coworkers and all of that, just because it's just the EMS culture is like, you kind of got to keep your mouth shut and learn for 3 to 5 years before you start to speak up a little bit. And not speak up like, protecting your patients from dangerous situations, but before you start to present yourself as like an expert on the subject, I guess. And so, if you want to do educational stuff, if maybe you have a background in something else, like, if you're coming with a background in biology or, organic chemistry and whatever, and it's relevant, then maybe then. But in general, I would say if you want to do EMS related stuff and it's going to be educational, make sure you can speak to that knowledge first. And then if you want to do stuff that's more entertainment value and all of that, I would still say if you're new, like, stay away from it, right? And if you are going to do it, just make sure it's not, like making fun of people. I know recently there was a thing, I don't know if you saw this, where it was like a OB clinic or like a gynecologist office, where they were something about like patients leaving and like, oh yeah, look at what you left behind, and it was like smears
See that,
and they all got fired, right? Like that kind of stuff is not acceptable, right? If your goal is there to make fun of patients, it's not acceptable. If your firefighter chronicles and it's a funny thing about how it just happens every time you're trying to make dinner, somebody calls 911 and you never get to eat dinner on time, like that's one thing, but absolutely never do anything that is making fun of coworkers or patients or anything like that. That is definitely not where you want to be.
And if you have any sort of public persona, right? Like, especially if you're brand new to this field, you're going to be under a spotlight, especially, EMS communities are fairly small. They're fairly tight knit. And so if someone hears like, oh, so-and-so's got a TikTok or so-and-so's got an Instagram page where they're doing this, people are going to watch it and they're going to have you under a microscope a little bit, and they're going to analyze you for what you're doing. And so, coming back to keep it educational, be sharp on your stuff if that's going to be the case, because it will come back to bite you. And, worst case scenario is that you're really confident in an educational thing you put out, and then it's wrong, and then it's costing people, life, limb. Well, you're kind of, I don't want to say responsible, but you're an influence, right? And so there's just things to consider. I'd say anytime. It's the same thing as like when I was going to college for sports. Just keep it clean. You don't need, everyone knows what the standard really is. And I know the standards kind of shift in that line of edgy moves, right? Just if you were to look back on this also in 5 years, would you want to be on the right side of where things are going currently? Because once again, if it's out there, it's going to stay out there.
Yeah. Yeah. And part of this question too is non-EMS related stuff. They're asking about, they said they're interested in voiceover audiobook type projects or other creative outlets that have their face and name attached. I think in general, that's probably fine. Again, if as long as it's the right thing, right? If you're like doing something that could be super controversial, or then it might be a different take. But I think in general, if like, you want to try to do voiceover work for cartoons, like that'd be really cool. I don't see why that would be an issue. I do know, then this is a whole different thing, that there's been women that had like an OnlyFans that kind of came back to bite them, which I know there was a New York EMT that had it, which firstly, like, let's deal with the problem that somebody working in a major city as an EMT saving lives every day has to resort to that to feed themselves. Like that's a whole different issue we could go into, but I know there's been a couple times where those kind of things have happened. Which I'm sure that they were not trying to cross those lives, and just somebody found it and it got brought to the attention. And I know for sure there was a woman in New York EMS that got fired because they found that she had an OnlyFans. So, there can be that kind of stuff too, which that's obviously an extreme case. But I think for the most part, if it's something that's not that line of work, or something where it's just like, I have other creative outlets. Before we started doing this stuff, I have a couple videos that I made of me doing motorcycle adventure tour videos, right? Of me riding my motorcycle I ride motorcycles and make little videos of it. And that was never an issue. My coworkers are like, oh, that's really cool because it was a fun little thing. So, you want to go make fishing videos or you want to do whatever. You're really into sports and you want to have a podcast talking about your favorite team. None of that's going to be detrimental. You can have creativity, and I would recommend go do that kind of stuff, right? Like,
you got a passion, do it.
Don't make this your whole life, just in general. Just make sure that you're not doing something that you'd be worried can come back and get you. Then you're probably fine.
Yeah, incriminating, right? Like to a sense, if it's something that they look back on and people are going to go, "Oh, I don't know," it's probably not on the okay side of the line.
Yeah, or if you're there and like, I'm only here because being an EMT sucks, then that's probably going to be bad too, right? So
don't bash on your departments either. That's a good way to be unemployed.
Yeah, that's a very good way to be unemployed. Don't bash on this as a thing, and then you're probably fine. Go pursue your other stuff. Be a complete person. Yeah, that's who we want to work with, right? And that's who's going to be really good at this job is people that have life experience and are complete people. So yeah.
Express your passions, folks.
Cool. All right, next one. What tips do you recommend for feeling awkward and struggling to lead calls when training in the FTO process? So having been an FTO for a couple different departments, I would say the biggest thing that I like, not really a tip that I can give to you, but just like, you're not alone. That is literally everybody. And maybe that makes you feel better, maybe not, but I promise when you're brand new, leading calls is so scary and so hard. Like, I mean, most people years before they start to get comfortable in that lead position. So before we talk about anything else, just realize like that is everybody's situation. And some of us are just better at faking it until we make it kind of a thing. But you're not alone in that. So take a little solace in the fact that it may not look like it's hard when you see somebody experienced doing it. Like it looks like an easy job. This is not an easy job. No, it's a difficult job.
I tell my students all the time is like, you're going to walk into your first call and you're going to be like, hi, my name is so-and-so. And then everything becomes a screen of blank white. It happens to everybody. It will happen to you, almost guaranteed. But where I think where the growth comes in is, okay, well, that didn't go the way I wanted. What can we do different next time? And then just try it, right? Oh, okay, well, that didn't work. I'll get past my name, and this time I'll say I'm an EMT too, right? Like, just add as you go. This is not perfect. And I've even told my students too, when it comes to, this is kind of a little bit off topic, but like when it comes to like assessments, right? You're going to be really, really clunky working your way through. You could listen to Chris and I do one, and we're going to hit every single point. Might not be in the same order necessarily, but we're going to hit every variation of that because we've done thousands of these. It's one of those like, this is experience makes the comfort. Now, don't get complacent, but experience will help guide your comfort. And eventually you'll get to the point where you're walking in like, what do you want? It gets to that point and you get more comfortable with it. It's going to be clunky. It's going to be weird. I would say another big thing, especially if you're an FTO, don't change everything about your medicine and how you want your medicine to be to line up with the FTO necessarily, right? Like your job is not to become their mini-me. Your job is to learn from them and better your own care. Take what you like, leave what you don't, and then on to the next one.
Some FTOs might disagree with that.
That's fair.
To be fair, I fully agree with you, but there's definitely the egotistical FTO that's going to expect you to do exactly as they do. So
sometimes survival is survival, and I get that too.
Yeah, you just need to get through it. So you kind of brushed on it a little bit. Like we teach the skill sheets in the classroom for a reason. And for some reason, like everybody's like, oh yeah, you're going to learn those medical trauma skill sheets and you're going to walk out and do it the real way in the field. We were just talking about this earlier, right? Like I would challenge anybody to tell me what call you don't arrive on scene, check your scene safety and make sure your resources are everything that they need to be and you're good there. Then you ask the patient what's going on, get an idea of the chief complaint, check their ABCs, make sure that there's no apparent life threats. At that point, you should be making a transport decision. Go get some background information, some sample history, some whatever, then do your good secondary assessment and then reassess afterwards. That is the basics of the medical and trauma national registry sheets. If you're struggling, just break it down to those major sections of what you're doing and really start to hit those as you go through, right? Like I'm going to arrive on scene. What do I need? Do I have it here? Oh, it's a car accident and there's no traffic control yet. Let's get traffic control here, right? Oh, they're talking about chest pain and they look real bad. Oh, let's get ALS here, right? So think about resources. What is killing them right now? Can I fix that? And then let's do some thorough digging, right? So it's really hard to lead things, but if you start to break it down really simply and kind of just have your method that works every single time, then you do it every single time, you'll get better at it every single time. So be really methodical about it to start with, I think is really helpful.
Yeah.
And people, for whatever reason, think like, oh, EMT school doesn't teach you anything, right? Like that's not true. Like
a lot of the baseline.
we're teaching, the basic cookbook. And granted, your grandma had her recipe that she added extra sugar into, or, a little bit of paprika, whatever it is, right? You're going to do that when you get good at this, but that basic recipe should stay the same.
Yeah. And there's maybe some tips I'm thinking more of like an FTO position too, is like, if you're in a room with your FTO and say you've got a fire crew also, this is from like an ambulance perspective, put yourself in the spotlight a little bit. Make sure you're the first person that patient is talking to, or stay in the line of sight. A bad habit that I had after a while or early in my career was that we would show up to something and I would start the conversation and then I'd let fire do their thing and they'd start getting their vitals. And then I would just slowly slink into the darkness back into the corner of the room. Well, now no one knows who's in charge because I established I was, but because I'm nervous, I'm subconsciously putting myself in a corner away from the situation. And it's recognition of that moment is going to be huge. You got to understand, okay, I put myself in a weird spot to be in charge of this call. So for me, a big one was like, okay, if I'm going to be the first person to talk, I'm not going to be out of that patient's line of sight within 5 to 10 feet at any given point of this call. And it's just finding your comfort with everything, right? And I would say be self-criticizing, not to the point that you're breaking yourself down, but you're trying to learn, right? And so the best way to learn is, what did I do wrong and how do I want to fix this? And that's just where you got to be. Recognize the moment and fix it.
Yeah. Yeah. And as far as leading, I would say one thing I'd recommend is kind of have your mental checklist of what needs to get done before you even get there, and start to check that off, or even have it written down, right? Like nobody has anything against the EMT medic that has their little notebook in their pocket that pulls it out. Have your little list of things that need to get done. I need to have vital signs checked. I need to make a transport decision. I need these things done. I need to make sure that the gurney's ready to go, and look at that and be like, oh, I haven't got that done. And then ask your team, right? Like, I've been doing this a long time. I'm a salty old dude. If a 19-year-old EMT asks me to do a thing politely and I know it's the right thing to do, I'm so excited to do it, right? Like, I'm very happy to do it with my trainee when they're like, hey, would you mind getting that gurney ready? I think we're going to start moving towards the ambulance here in a minute. Cool. Right on. Thank you for telling me what to do. The fire captain that could be your grandpa, like, he's okay with you asking him, not telling him. He's okay with you asking him to do things for you, right? Like, this is a team sport. And I think that leading things can be very intimidating when you're brand new, until you realize we're all here for the patient, right? And everybody is here for the patient. Use your pleases and your thank yous, and it's going to really help. Take the time, try to learn the fire guys' names. If you're on the fire side, try to learn the EMTs, the ambulance personnel's names, right? Like, it goes really far, and you can say, hey, Wade, can you grab a blood pressure for me, please?
You know my name?
It does. It makes a big difference, right? So try to build that up. And for me, that was a very active process. Like working where I was here, I mean, there's 30, 40 fire stations with 3 crews of 3 to 4 people each. There's hundreds and hundreds of guys that we would be likely to see throughout the time, throughout a shift. So it's not always perfect, and they might not have their name anywhere written down, but if it's a crew you haven't met before, after the call, as you're loading up the ambulance, like, hey, nice to meet you. I'm Chris. I'm a new EMT. Yeah, I'm working with Wade, my FTO here. So I'll probably see you around. Cool. Look forward to seeing you on the next call, right? Like, that stuff, the next call when you show up and you're like, hey guys, can you put a seat collar on him? Oh, cool. Yeah, no problem. Right. Like, then that goes really far as leading the call. Right. And that's really intimidating. But once you start to feel like you're on a team, it's a lot easier and it's a lot smoother.
Yeah. And remember too, delegating is your friend, and that everyone there wants to be doing something. So if you see 6 people standing around with their hands in their pockets, maybe we'll start delegating some tasks. Want to keep moving?
One other thing that I always try to impress upon, yes, we will, but upon new EMTs and whatever, right? You go through EMT school and it's all this crazy stuff, and it's really not that hard, right? So, you know, I got Wade here, right? Like, Wade, what's your favorite sport?
Soccer.
Soccer. Who's your favorite team?
Barcelona.
You played soccer, right?
Yeah.
How long did you play for?
A long time.
Yeah. What position did you play?
Outside back and striker.
Right. So now we'll replace that with like, hey, Wade, why'd you call 911 today?
My chest hurts.
How long ago did that start?
Like 20 minutes.
It's not, you're just having a conversation, right? Like it seems like it's this super complex thing that we have all these little boxes we need to hit and whatever. Just have a conversation and be curious. And if they give you an answer that something seems like you want to know more about it, then ask more about it, right? Like it really breaks down to being that simple. And once, for me personally, once I was like, dude, I'm just talking to somebody, right? Like I'm just, the conversation is not about their favorite sport. It's about, you know, like what's going on, why they called 911 and why I'm here. If you can just break it down to those simple terms, I feel like that's really helpful when you're new to realize it's not some big, massive thing with your proctors looking over you, right? Like just have a conversation. And when there's an obvious question, ask that obvious question and you'll probably do a little better.
Yeah. And your answers will also create the next question, right?
Big time.
You'll start to understand like, oh, this is a probing question because I think this could be going on. And then they're like, oh no, that's not going on. It's like, okay, well, scratch that. Let's go this direction now, right? Like it's variable and you'll figure it out. It's just time and experience, unfortunately. And sometimes that's looking a little and feeling a little dumb.
This is true.
That's just part of the game.
All right, let's move on. Next one.
All right. So I'm 5 weeks into EMT class, and the talk of the verbal abuse between coworkers is very discouraging. I mean, I have an A in the class, but that's very discouraging and making me rethink continuing the field. I have questions about this a little bit. Is it, you know, hearsay? So of like your classmates saying, oh, well, my coworker who works in this field they're talking like this and they're just really demeaning, lack of a better description. You know, because that's one thing where it's like, well, you don't got to work there, would be my mindset, right? Depending on your circumstance. And here's the kicker is that you're going to find people you don't like just about everywhere you go. I mean, I work with Chris, right? Like,
poor guy.
He's great, but you're going to run into people you don't like. This is a field of clashing personalities where you're forced to live with each other. Now, not everyone's going to clash. I'd say about 80 to 75% of us are fairly like-minded individuals. You just got to get past their layer of individualism to get to that point where you're like, oh yeah, I also like that or whatever, right? But I wouldn't let that discourage you from entering this field. Don't let the experiences or the words of a few people influence your future, right? Because at the end of the day, you can also just be the opposite. I don't like the way they're talking. I'm not going to do that. Do it. Change the medicine the way you want it to be changed and take your career where you want it to go. There's a lot of FTOs that I've had and medics I've worked with where it's like, I like the way they're doing that. I'm going to steal that, in fact, and use that in my own practice. That's a big part of it. And the same thing, I've had coworkers where it's like, oh, I did not like the way they treated this person or talked to this. I will never do that. And it just comes with, that's part of the experience. That's part of the learning curve, right? Experience is not just I did medicine or I did trauma, right? It's, oh, I didn't like this or I really liked that as a whole entity looking down on it, like the whole call, looking at it from top down. What did you like? What did you not like? From organization to medicine to whatever, personnel. Don't let that influence you too deeply, essentially, right? Be your own person and be your own provider. And more often than not, the provider you want to be is going to be a pretty darn good one. You just got to give them a chance to grow and learn from everyone around you.
Yeah. Yeah. I mean, there's definitely some more toxic cultures in EMS, and I think it's gotten a lot better, thankfully. It is a real concern, but I mean, I don't know. I've never had really a bad experience. Like I've made really good friends doing this job. I've worked a number of different places, that everybody generally was really cool. And you're going to have the bad apples for sure here and there, but for the most part, it's pretty cool. I just wish there was a little more context about, cause I'm pretty sure this was actually something that popped up from an older video. So maybe there was some context to what we were talking about there that I wish we would have known. So, and maybe this is about maybe when you're new and people can be a little harsh. So if that's the case, I would just say work really hard to be above reproach. and put in that extra effort to make it hard for somebody to have negative things to say about you and your medicine and as you're learning. So, which is a lot easier said than done. But, I definitely don't think if this is what you want to do, I don't think you should take having heard about some bad work cultures as a reason to not do this. Maybe stay away from a certain department because you've heard about a culture that you wouldn't want to work in. But I would say as a whole, for the most part, EMS people are generally we're very similar in a lot of ways, good or bad. But for the most part, we're all there for the right reasons. And those similarities make us kind of have similar senses of humor. And a lot of us have a similar outlook on life. So I feel like we get along with each other generally pretty well. And I'd say my experience as far as the people that I work with and all that has been overwhelmingly positive, and just really good people that want to do good things and for their communities and really, they're just the helpers, right? EMS people are just the helpers, that tend to have, pretty low ego. Like we make jokes because we're kind of the forgotten first responders, right? That just kind of show up. We're the little elves in the shoe shop, right? Helping the cobbler out kind of a thing.
I was going to say redheaded stepchild, but I don't know if that's loved. Take that back.
You're going to get canceled.
No.
But we're just kind of the ones in the back doing the thing that people forget about, right? And so we all kind of have that same perspective. Can you find some people that are going to be verbally abusive? For sure. The good news is you can try just not to ever work with them, right? Like we and I worked together at the same place for 3 years, 5 years, something like that. And we worked a handful of shifts together, right?
Yeah.
So you can definitely try to do that or just find a different department. But if this is what you want to do, don't let anything like that discourage you from going to do this, right? You can find the right spot for you that you fit really well, and you can have a fantastic time as far as that goes.
And I think, maybe reading a different avenue of the verbal abuse here is like a lot of us are trash talkers, and we talk a lot of trash to the people that we find to be our friends. And if that's something that's overheard, like I'm convinced that if people heard my wife and I talking to each other, they'd be like, they don't like each other very much. It's just some people just communicate that way. Right. And so there's going to be the line of like, don't take things personally, but also like understand there is the line of that is abuse and you should not stand for that to any degree. But if you're overhearing conversation between two people who are maybe verbally berating each other, there's a lot of circumstances around that. They could be good friends. Like there's a couple of people that come to my mind that as well, that listening to them talk, they are letting each other have it. Best of friends. You would never guess, right? It's just one of those things. So be careful, I guess, also with going with a bunch of hearsay stuff, because a lot of it, until you've experienced it, is hard to verify.
Yeah. Yeah. If you guys heard how we talk to each other once that stop button is pressed, especially with Sabrina.
Yeah. You got to comment. Dude.
Yeah. You would be, I joke around with my wife all the time. Like if you talked like we do at your workplace, like you would have gotten sued and fired and it'd be really bad. So,
HR.
And for us, that's just like that's just our way of showing love, right? That's our love language, is to talk trash to each other and call Sabrina a troll and all of that. So, like troll, which could be a different thing than what we're talking about here. But to your point, right? Like, when you've been in the trenches with each other a little bit and you've been on that 3 a.m. pediatric whatever call and all of that, like this is just kind of how we communicate with each other. And that's what I was talking about, like life perspectives and how it is a little bit. And so really common for us just to talk trash to each other. And that's just kind of how we cope a little bit and show love to each other.
Yeah. Just understand the lines as would be the big one.
Oh yeah, for sure. Don't let somebody walk over your line. If you're not comfortable with it, I promise you that the big burly firefighter is going to respect it. If you're like, bro, that's not cool. Like I get what you're trying to get at, but that makes me real uncomfortable. Can we please not talk like that? They're going to be respectful. For the overwhelming majority, you're going to be really respectful. Like, oh, sorry, dude. I didn't realize I was stepping over a line. I'll make sure to not do that anymore. And you're probably going to be fine.
And if they do push back again, then you have options. Remember, there's always moving things up the chain if you had to, right? But a lot of us too in this field, if you just tell me like, hey, I had a problem with what you said, most of us are going to be receptive enough to talk, at least have a discussion about it, But
next one, I don't think we'll really talk about. I'll read it, but it's something that we've talked about just kind of doing its own whole episode on. So, hey guys, I've been watching your videos and podcasts, and you guys always touch subjects that every new EMT like me should know. A topic I'd love to see you guys talk about in a future video, or maybe a podcast subject, is simply how to talk to patients and hospital staff smoother. I do IFT and would have loved a heads up of how difficult it can be simply to talk to the patient you want to get vitals from, or ask the nurse if the patient is a full code. Would love to hear your experiences. So, it's something that we have lots of nurse friends, and it's something we've talked about that just we haven't been able to schedule people in to come in and at the right time to talk about it. But I don't think we'll really touch on that here because we've gone a little long, and it's just, I think, a long subject. But we love the suggestion, and like I was saying, definitely something that we want to talk about, because I had no idea how hard that nurse to EMT relationship could be, especially at first. I've definitely had the experience of, after a while, we don't hang out outside of work, but like some of those people feel like friends, and we just joke around as we come in. And like, I've got some funny stories of trash talking nurses. ER nurses are ruthless.
Yeah, they're mean sometimes
about that. Right. And so, yeah, definitely something that we will brush on, because I do think it is an important subject that we'll get back to. I just don't think right now is the time.
Yeah. Yeah, I would agree.
Cool. You got any closing thoughts, Mr. Wade?
Keep the comments coming. I love the questions. Happily would do this kind of stuff more frequently. So if you guys got any questions, we'll answer them best of our ability. But yeah, I think this went fairly well.
Yeah, we do obviously we are EMS instructors. It's our job. Like, this is what we do. So we like to talk about the medical trauma stuff and all of that, but we're also a resource. You've got 20, 25 years of experience between the two of us here, and we can pull lots of experience. We have lots of friends that are happy to come and talk. So you guys have these questions, we'd love to answer them, because we can pull from a deep well of experience to answer those things. And as always, like I said before, this is our experience. Maybe people will differ, but yeah, I think this should hopefully be kind of a regular thing in the future, just kind of answering listener questions. So if you're going to put something on Buzzsprout through the comments there, we can't answer back. I've said it before, but every once in a while we'll get something on Buzzsprout, which is the podcast hosting. We can't see who sent that, and we can't respond to you. So just be aware of that. But yeah, if you're listening to Spotify, you can leave comments, or YouTube, leave comments. We'd love to answer them.
Yeah.
Speaking of, we have the new podcast channel, which I should have talked about at the beginning of the episode. We have the new podcast channel on YouTube. So please go check that out. Subscribe to that one there. We're not 100% sure when we're going to stop posting on the Summit channel, but it should be pretty soon. So just make sure you go subscribe over there, so that you don't miss future episodes. I think we kind of have some, we're not going to talk about it exactly, but I think we have something kind of fun planned for the new channel that we don't really want to do on the educational channel. So keep an eye out there. We might do something a little more fun, a little different than sitting at a desk and talking to each other this next time. So, but yeah, like we were saying, please leave comments. We'd love to help out. We'd love to mentor people. That's why we're instructors. That's why what we're here for. So you got questions, please ask them. Otherwise, have a great day, night, whatever you're doing. Sabrina's shaking her head at me. It's always hard to finish these things off to close them out. Have a great day. You guys are awesome. We'll see you next time.
Okay, bye.